very much. Hi. I'm Johanne Kenney.
Joanne, I'm Dr. Lacey.
Hi,
Pleased to
Dr.
meet you.
Lacey. I'm so excited to meet you.
You look very excited.
I am.
I have been looking forward to meeting you as well.
Awesome. I just want to thank you for being a part of the Ottawa Makeover project. It's really exciting to see businesses chip in and do something like this. It's incredible. So thank you.
Yes, it is my pleasure. Okay, and I can see why you were chosen. Okay, because you are an excellent candidate.
Great.
Very good, and a good person. Come have a seat.
Thank
please.
you. Visible, but I definitely see it in pictures. I'm very shocked when I see pictures of myself the last 5 years or so with the bags under my eyes.
Right.
And as well, I have, like a frown line there. I find sometimes, it actually makes me, like, it's tight and kind of makes my forehead feel tense.
Yeah. Some people they will get headaches
Mm-hmm.
from that area.
Yeah.
Now, you have touched on some really important points regarding aging of the eyes.
Right.
And in fact, when we meet people, the first thing we look at are the eyes.
Mm-hmm.
So
That's
often
true.
in plastic surgery, we start with eyes.
Mm-hmm.
What I'd like to do is I'd like to get a mirror,
Okay.
and we'll look in the mirror, and I will explain to you what we can do. Okay. And then, as you probably figured out for the lower lid, this is what we do
Cool.
here.
I wasn't even sure that something could be done about that.
So that's what we do.
Wow.
And there's a little bit of extra fat here.
Yes.
And we can actually take that fat
Mm-hmm.
and help fill this little teardrop here.
Okay.
So the overall look is something like that, minus this skin here. But so this is the incision here, and then here is that fat that we're seeing.
Yeah.
And then this is the skin that's removed.
Okay.
Okay. Then for the eyebrow, there is an incision up here within the hairline so that we can lift up.
There's a band
The
of
brow.
muscle there that gets.
Well, we lift up the skin and we lift up the muscle as well. There's a little, there is certainly muscle everywhere pretty much, but what we're lifting up is the scalp.
Okay.
And we lift it up just like my fingers were holding. As far as eyelids go, it's straightforward surgery, it's predictable results, and my preference is to have you asleep for that. And especially if you're adding a brow lift, then it's, I find it more important that we have a general anesthetic. Okay? Do you have any questions on eyelid surgery, uppers, lowers, or brow lift?
No, thank you. That was a lot of good information. Yeah.
Okay. So I guess finally, I know it's a lot of information, so at the pre-op we can certainly talk about things again, and you can also visit our website,
Yes.
okay, to look for more information, some links, things like that, okay? And today we'll make sure that we give you a brochure with some other stuff to read, okay?
I guess I do have one question.
Yes.
How does this procedure change with weight loss? So, like, I know that I'm going to be losing weight. I have
Right.
a
That's part of
personal
the
trainer 3
program.
days a week for 6 months. I'm going to
Yes.
lose weight.
Yes,
Unless I'm horribly non-compliant with my mouth, which I don't plan on being.
Yeah.
So is this something that is done closer to the end then, or does it matter? As
It
far as
probably
facial...
doesn't matter. I was just having a little look at
Yeah.
you here. I think even if you were to lose 20, 30 pounds, there may be a little bit of loss of volume, but it will not affect your eyes.
Okay.
So we're okay there. If we were, even your face is probably okay if we're doing a facelift. But usually, it's a great question. Usually we prefer to wait until major weight loss.
Right, yeah.
Okay, but the eyes, I would say, are an exception.
Okay.
So we can pretty much do this whenever it suits you.